Nicola Hill is joining us from London. Nicola, good afternoon to you. So, do we know any more about this study, and how credible do you think it is, even though it hasn't been peer-reviewed just yet?
Yeah, it's an interesting study. It's actually not that surprising to a lot of the scientists. I mean, we know, for example, that if somebody is clinically obese, they're at a much greater risk of both getting the coronavirus, but also being hospitalised. I mean, the risk increases by 113%. And dying from coronavirus, that's like nearly 50% increase in people who are clinically obese. So this study, as you say, it is a small study that hasn't yet been peer-reviewed in Italy. It was of 248 healthcare workers who had been vaccinated, had 2 of the Pfizer-BioNTech vaccine. And 2/3 of them were women, 90 of them were men. And it did find that basically the people who had the strongest immune response were female, were younger, and importantly were, as they described them, lean. They were slimmer, and it was the older males who were overweight who had a much lower immune response. Now, as you say, this is a preprint that's been published, so it's not been peer reviewed. So I spoke to a couple of UK experts this morning just to find out a bit more about it and to find out why that could be the case. And Dr. Simon Clark, who's a microbiologist at Reading University, said there is evidence in the past to show that vaccines are less effective on people who are clinically obese. They're not exactly sure why, but they know, for example, that the influenza vaccine is only half as effective in people who are obese than people who are slim. And the hepatitis B vaccine is also nowhere near as effective. So whether it has some sort of reasoning is the fact that the obesity, the adipose tissue, has an impact on the killer T cells, the cells that actually kill viruses. Whether it's because obese people have a much less diverse gut bacteria population, flora and fauna in their gut, which we know is a fat, so whether that has an impact, they don't know either. I also spoke to Professor Paul Hunter from the University of East Anglia, and he sent me a lot of interesting scientific literature that shows the fact that vaccines are less effective on clinically obese. Very interestingly, particularly on overweight children, obese children, and we know that children are normally the population that are vaccinated the most early on against diseases. Of course, they don't actually have the coronavirus vaccine at the moment because it's not been tested on children, but they do know that, you know, vaccines aren't as effective on obese children. So both of the gentlemen I spoke to today and the other scientific literature that I've been looking at say that much more research needs to be done, and it seems that that's the case. The Italian group did say that larger studies now need to be underway because they only looked at the Pfizer-BioNTech vaccine. We don't know as yet whether there are studies or results of any studies looking at the other vaccines.
Interesting, Nicola. And it strikes me that perhaps it's now again then time to just reinforce that healthy eating, watching your weight and exercising message to people that's constantly being pushed by health officials.
Yeah, very much so. I mean, I did ask Dr. Clark, I said, look, you know, is this just the clinically obese? I mean, many of us have put on what here in the UK we're calling the corona stone. We've all put on weight because we're in lockdown, you're only allowed out for an hour a day exercise. And he said, no, it's mainly the obese population. You know, it's clinically obese, i.e. you've got a body mass index of more than 30. But according to WHO figures, like 39% of adults over the age of 18 are overweight, 13% are obese. So there's an awful lot of people. The other option that could be for people who are obese, as far as the coronavirus vaccine is concerned, is to perhaps give them a third booster shot. Booster shots are given to obese people with the flu vaccines, or potentially they might be given a higher dose of the vaccine, but that's not been tested as yet.
OK, Nicola Hill, thank you for that.